This video, I want to briefly go through the MLD, the massage component. Now, this is going to be different depending on the clinician's training that you go see. I've been trained through the Academy of Lymphatic Studies as a CLT. I've also attended additional training from Norton. And the schools are subtly different. They use the same text for education. And actually, funny thing is that my training, was both the co-authors. This is basically the Lymphedema Therapist's Bible here. This is what most of us are trained on, and a lot of the techniques are similar, and the foundation is the same. It's just there's subtle differences in how it's dished out. So depending on the therapist, you may have one that does it a particular way. It doesn't take away from, each individual has their own method that they've seen success with. So I don't want to take away from somebody else's technique. As long as they're doing the same foundational concepts, I think it's still very effective. Now, patients really tend to get caught up in, it gets sometimes confusing when you're talking about the direction of fluid pathing, or when you're talking about the direction you're trying to move fluid. So in general, I'm going to use purple to represent, and we're going to use the same example of a person that maybe has right upper extremity lymphedema. So this person, we're going to say that they have had breast cancer, right breast cancer, and now they have had a bilateral mastectomy, okay? So they've also had lymph nodes removed, okay? So in the case of somebody that has just had we'll call it a right-sided mastectomy, a right unilateral mastectomy. So they have had the right breast removed, or the tissue excised. And then they've also had lymph node dissection because there were either a biopsy that showed positive lymph nodes and the surgeon had removed those. So now that we have decreased health of this tissue, it has less of an effect on the removal of this fluid in the right upper extremity, as well as some of the right trunk. Now, that incision, depending on length, quality, this may have created a dam effect. Now, incisions can sometimes lead to a lot of scarring, and scarring is basically like a beaver building a dam in the water. It's going to cut off that flow of traffic. Now, we have separate pathways. So we can try to recruit. We discussed in a previous video that we're going to try to recruit other areas of healthy lymph nodes to assist this impaired area. Those areas that we're going to consider here are our right axillary lymph nodes, or our right cervical lymph nodes, our left axillary lymph nodes, and our right inguinal lymph nodes, okay? Now, because this dam is here, because of this incision, this may impact the ability of me to recruit this area in the right groin. I may still try to do that. If I see pocketing of fluid above the incision line, I'm going to probably stop, and I'm not going to try to redirect fluid down that way. But I also have this pathway and this direct pathway. And so our goal is going to be to recruit these areas, stimulate these areas to be able to collect fluid. Now, these other three areas are already doing a full-time job. So we need to help before we start working and pushing fluid up towards those areas, we have to start by clearing these lymph nodes of the fluid that they are filtering through before we can send fluid across. Think of it like a traffic accident or a traffic jam. I need to be able to clear the accident before I send traffic through. Otherwise, I'm just going to be sending traffic into a backed up traffic jam, okay? So, step one, and this is very underrated. We are going to stimulate these main collectors by deep breathing. And this is diaphragmatic breathing. So this is truly belly breathing. So I'm going to take a deep breath in and try to just stimulate my diaphragm. that diaphragm has our main collectors running straight through it, and also helps to stimulate and compress upon some of the deeper lymph nodes near our organs. So diaphragmatic breathing 5 to 10 times can be very effective at starting to stimulate those deep collectors. Okay, so that's step one. We're going to do that 5 to 10 times. Okay, then we are going to clear and stimulate these circled areas here. Now, we can clear these circled areas through one of a few different strokes. We can use a stationary circle, which is what I recommend to most of my patients. We are going to stimulate these areas, and on yourself, it's a little challenging. You're going to use the opposite hand, so my left hand and the pads of my left hand are going to go in the pocket above the collarbone. Some therapists will teach it as pumping, where I'm just getting a little bit of a deeper pressure into that cervical area above the collarbone, or a stationary circle where I'm dragging the tissue down and in towards the body. And I may do that 5 to 10 times again. So 5 to 10 times here using pumping or circles. And circles is just down and in, okay? 5 to 10 times. Now, I'm going to do the same thing to the left inguinal, or the left axillary lymph nodes. And that, again, I'm going to take the pads of my hand, get into my armpit. I'm either going to do 5 to 7 or 5 to 10 deep pumps, or 5 to 10 stationary circles, up and in, okay? This is always more effective with skin on skin. I'm just not going to remove mine for the sake of most people watching, okay? Now, the next thing is our right groin. Now, I have people do this together because I find that it's very easy to do things bilaterally sometimes, especially with the groin. Now, and I don't know if you can see, but pads of my hands, again, are going to go on the inner thigh just below the groin fold here, okay? And I'm going to go in and up, okay? And again, skin on skin is much better. And you can also do pumping here. So 5 to 10 times here, 5 to 10 times here. Now that's going to stimulate and clear those areas of lymph nodes. That's going to clear them to allow us to start moving fluid. Now we're going to take, starting at the sternum, we're going to call this the sternum, okay? And then this is a line that represents our top of our pelvic crest and like in line with our belly button, okay? We are going to start at the halfway point from the sternum, and we're going to push towards the left armpit. Same thing down here. We're going to start at the halfway point and we're going to push fluid down towards the groin. And when we do that, we're going to use a very, very light stroke. Now, skin on skin is going to be more effective. And think of it as you want to take the pads of the fingertips and the palm, and you're going to get a light skin stretch, okay? And so doing that, you're going to have to start with your opposite hand. So my right hand starting at the sternum, and I may just try to do a pushing stroke where I push, I just get a little skin drag across the chest, okay? I'm going to do 5 to 10 times, starting at the sternum, working my way, overlapping a little bit to the left armpit. And then I'm going to take my left hand, starting at my right armpit, and I'm going to be pushing fluid all the way across now, okay? So once I get to my sternum, I switch hands again, okay? So that is across the chest. Now down the side, and for reference, I'm going to say that my halfway point is here. And this purple line that I've drawn, imagine that if I drew a line from my armpit to my groin, that's going to be my line. I'm going to start here, and I'm going to work my way down and I'm using a circular stroke here. It's a little harder to use a pump when you're doing this to yourself. And then I'm going to come all the way up to my armpit, and I'm going to work down. Okay. Now you don't have to speed this up. You don't have to go fast. The goal is that you're getting a stretch of the skin, and it's very light. I find most people are very heavy-handed with this technique, and I think that's where people's comfort comes with insecurities, is that they feel like they're pushing too hard. And if you feel like you're pushing too hard, you probably are. So really think of it being a light, gentle skin stretch. You want to pet the cat, not grab the cat, okay? Now, once we've stimulated this pathway and this pathway, we can start working in the upper arm. I like to work in the upper arm first. We're going to be sending fluid. We're not going to be directing fluid towards this area of unhealthy tissue. We're going to try to send it around, okay? So think of it as going from inside of the arm to outside of the arm and up the lateral side of the arm, okay? So this is going to be, we did this, we're going to say 5 to 10 times across the chest, 5 to 10 times down towards the groin, and we're going to come back to this in a second. But we are going to start in the medial arm, and we're going to go inside to outside. And I may do 5 to 10 passes. And I'm coming up the outside of the arm. Some people like to rotate their hand out. You can do it that way, whatever's comfortable to you. If you want to set the arm down so you can relax so you're not getting fatigued, that's fine too. So 5 to 10 times working from inner arm to outer arm and up the outside of the arm. And then we can come into the elbow and work the front of the elbow. We can also then, from the elbow, work our way back up. And that's what we would call clearing. So we're decongesting and moving as we're down here. And then as we come back up and through at the end, that's called clearing. So we're just basically reminding the fluid where it needs to go, okay? Then we'll come down into the forearms. If there's edema this far south, starting at the upper arm, and I'm working my way up. I'm using a pumping stroke, so I'm essentially getting the majority of my palm and my pad of my fingers on the tissue, and I'm pushing up towards the elbow, okay? Once I get down to the hand, you can do the top of the hand, or I should say the back of the hand, and it's a stationary circle, and my goal is to just get a little skin stretch, okay? So I didn't draw this up here because I don't have a good, I'm not an artist, but we'll say that's a person's hand. Looks like a cloud. So we've done the elbow, and then we've done forearm and hand. Even the fingers, you can get into the fingers a little bit, and you can do some light pumping on the back of the fingers. That's typically where it likes to sit. And then once you've gotten through the hand, we come back through 1 to 2 times through all of the pathways that we've just done. So we come back through the hand, the forearm, the elbow, inside to outside of the arm. We're going to come across the chest, we're going to go down to the groin, and we're going to even send up this way. So as you're coming outside of the arm, you can kind of drag it upward towards the cervical lymph nodes as well. So once we come through and redo basically steps 7 to back to step 1, we're finishing with deep breathing, okay? So you're going to go in reverse all of those steps. So hand, forearm, elbow, upper arm, across the chest, down to the groin, our inguinal lymph nodes on the right side, our left axillary lymph nodes, and our right cervical lymph nodes. And then we're going to end with some deep breathing. And then that's going to be your full sequence. Now, I know that I went through that kind of the end of that quickly, but if you remember the first amount of detail as you come through, and replay the video back through it and follow along. So this doesn't replace guidance from your therapist. So I definitely recommend you get in touch with a certified lymphedema therapist in your area if you have questions. A lot of times your physician is not going to always be super knowledgeable about these types of ailments, and lymphedema therapists are specifically trained to treat these areas. So this is just for a right upper extremity. So there's other pathways for the left arm as well as for the legs. And so there's going to be separate videos after this going through some of those things. But this is for the right upper extremity, self MLD massage. And it definitely encompasses some difficulty, but I think with diligence, people get really comfortable with the pathways, and it can usually be done within 15 minutes, and doing that a couple of times a day can be very effective. Okay.